I am at my weekly doctor appointment. I'm only 33 weeks along, but I have to come to the doctor every week because I have to get weekly stress tests on the baby. And so since I have to go to the hospital and get weekly stress tests, I now have to come to my doctor every week, rather than starting at the 35 weeks since I'm considered high risk. So this is just one of my appointments, and I'll try and record as much as possible. My belly's getting big. I don't know if you can see it or not. She's in there growing, getting nice and healthy and plump, moving all the time. So I'm really excited for that. So I'll come back to you soon. So the room I showed you earlier, that was just the room they had me in. This is the ultrasound room, because I get an ultrasound every time I come to the doctor. And this little pregnancy and birth chart always intrigues me for some reason. Anyway, this is the ultrasound right there that they will see Miss Mariah on. And luckily, I get to see her every time I come to the doctor. So I've seen her a total of maybe 20 times. And I've gotten to see the whole process of her, like, growing from a little bitty speck, in my opinion, to a full-blown baby. And I think the whole process is just so beautiful. I think that's it. Guys, sorry that I couldn't record my actual doctor's visit. My doctor wouldn't allow me to, so I just had to come back and give you all an update. Everything went fine at the doctor, though. My blood pressure was 120/73, which is good because they've been really trying to watch my blood pressure. And my weight that I've gained so far throughout the whole pregnancy is at 11 pounds. But even though I actually lost 3 pounds from last week, which my doctor wasn't too happy about, but I eat all the time. I have no clue as to why I lost the 3 pounds. So that puts my actual total back at 8 pounds that I've gained for the whole pregnancy. I think my weight gain has been so small because when I was like 21 weeks, they found a condition that I had called pseudotumor cerebri. And I honestly knew nothing about it. This is a condition, and a condition that I had prior to pregnancy that I just knew nothing about. And it affected my eyes. I ended up getting something called papilledoma in my eyes, and I ended up having to have surgery. So I was out of commission for a while. My eyes are a lot better than what they were, but they're not what they used to be. So I'm praying that after the baby comes out, everything kind of just falls back into place and gets back to normal. Other than that, my next appointment with her, which is just my regular OBGYN, is next Tuesday. But I have to have a stress test because they're checking the stress levels of the baby every week. So I have to have a stress test on Thursday. And I also have to go to the surgeon who did my eye surgery on Thursday. He's out of town. He's like 2 hours away, so we have to travel to go see him. And then I have to go see my high-risk doctor in a couple more weeks. So I'll just try and do like a day in the life of a high-risk pregnancy woman, so that you guys can kind of get an idea, because I'm sure there's other people out there who probably have this pseudotumor, and I knew nothing about it. So hopefully just me sharing my story will help someone in the future, because this is a condition that I guess I've had and I just knew nothing about it. So even if there's someone out there who has a pseudotumor cerebri and they want to get pregnant and they want to know maybe what the side effects are or whatever, I would be more than happy to help them. I take like 4 different medications a day. So, but I think that's it for now. So hopefully I can get some other appointments recorded, and I'll come back and try to explain the condition that they found the best that I know how, because I'm honestly still confused. So, yeah, see y'all later.